Thanks for spending part of your Tuesday with us here on Mid-Morning. There's some big news for those who might need the cheaters to read.
A Bloomington doctor just wrapped a successful trial, we're told, that uses eye drops to correct nearsightedness for 40 to 55-year-olds. Joining us live with news from me, Dr. Ralph Chu from the Chu Vision Institute. Dr. Chu, nice to see you. I know a lot of people in our age range sort of hesitate to use those cheaters. It feels like you've given up and given in to age.
You know, it's one of the things that really identifies us as, getting older. And they're really inconvenient as well. So this is one of the most exciting things that's happened in the last 20 years in ophthalmology. The market is huge. There's 125 million people alone in the United States that could qualify for this.
I mean, this feels like on par with the LASIK surgery that was introduced all those many years ago. How do these eye drops work?
These eye drops work by modulating the pupil size to give us more depth of focus. So we're, able to find the right pupil. Patients can use this once a day in the morning, and then they might not have to wear reading glasses for the whole rest of the day while they're at work.
Pretty amazing, right? And people can use it, maybe in the morning. If you don't need it in those hours, you just take it at night, right? They last about 6 hours, you said?
Yeah, in the trial, it was for 40 to 55-year-olds once a day. It worked as quickly as 15 minutes, and we saw an effect out past 6 hours.
Wow. So you finished up the trial. You say it was successful there. What are the next steps now? When might people be able to get this?
Well, this was just FDA approved about a week ago, and this drop will be available in the marketplace in about 4 to 6 weeks. So mid-December, we should expect this available to our patients.
Is this something that insurance might cover?
This is going to be a cash pay, and we'll kind of know more about the price as the launch approaches in mid-December.
Mm-hmm. You still need glasses or contacts, right? If you are currently using that, this doesn't solve this, does it?
This is specifically for the aging process of the eye called presbyopia. So patients who wear contacts, glasses, they can still benefit from this, but they'll still have to wear their correction for that nearsightedness or their prescription. People who have LASIK, they also qualify. Sorry.
Mm-hmm. Yeah, no. I know there's a couple of different eye drops brands that are being tested right now. How did you are working on this very particular one? What's it called, and how were you involved in being part of this trial?
Yeah, we were a principal investigator in this clinical trial. The drop name is called VUITY, and this is the beginning of a new paradigm in treating presbyopia. There's about 5 other drops in the pipeline, but this is the first and currently only treatment approved by the FDA for the treatment of presbyopia.
Very cool. All right, I'm watching. I'm waiting. That's right. 46. I'm right in the wheelhouse of this age group and the need, too. Dr. Chu, congrats on the trial, and we appreciate the information this morning.
Thanks for having me. Good to see you both.
You too.
Okay, a lot.